Milk supply. This is probably the biggest concern for breastfeeding and pumping mothers. Do I have enough milk? Do I have too much milk? How do I get the milk out? How do I store it? How do I feed it to my baby? Why isn't there enough? There's too much. It's a lot. Your milk supply will look different depending on your health history, how you choose to feed your baby, and how you manage your supply. So in this video, let's talk about several different scenarios and what you can expect from your milk supply based on how you're feeding and the variables that come into play. I'll also include chapters in this video so you can skip around if you need to, but I do think it will be helpful to listen to the whole thing. I think having a really solid understanding of milk supply is how we end up with good milk supply because we know how it works, we know what we're doing. Let's start out with mothers who are exclusively breastfeeding, all right? Your milk supply is managed by the baby. And some important notes here are the baby's latch and efficiency in removing milk is key. We've got to get a good latch. The baby has to get milk out or we're leaving milk behind and your supply will decrease. This is a type of milk supply that relies heavily on supply and demand. They all do. But when you're talking about the supply and demand cycle for an exclusively breastfeeding mother, it would be heavily based on feeding on demand, meaning that you are feeding the baby whenever they're hungry, no matter the schedule. Sometimes with this, we see a low supply if the baby isn't latching well or the mother has other risk factors for low supply in her health history. But we'll talk more about that in a minute. We don't usually see an oversupply in exclusively breastfeeding mothers unless they have an underlying condition causing that, which we'll get to, or they have caused that by adding in extra demand, like pumping or something like that. The next category of milk supply we have is for those exclusively pumping, and your milk supply is managed by your pump. So creating and sticking to a good schedule is one of the key factors in establishing a good and healthy milk supply. You also need to have a good pump, all right? Having a pump that is reliable and efficient in removing milk will be also a really important factor for you to manage your milk supply appropriately. Most moms who are exclusively pumping do have more than one pump, usually one for convenience and then some more like sturdy tabletop ones. They usually like trying new pumps because you're just pumping a lot, okay? Exclusive pumpers do have to manage all of the aspects of pumping, your flange size, you're a little bit more aware and in control of your letdowns, the time you spend pumping, not only the schedule that you're on, but the amount of length per session. We're not feeding on demand here. Your pump is not demanding any milk. It doesn't tell you when your baby's hungry. So you really have to rely on a schedule and a pump to make your milk supply work. Low supply can happen in this case, but it's usually a result of inefficient pumping, which could be like a poor flange fit or inconsistent pumping. So we're not sticking to that schedule. It can also be a factor for those who don't start pumping soon enough postpartum. If you're exclusively pumping, you should start right away. So we don't get to wait and then jump in earlier and expect to have the milk supply that we always wanted. So just keep that in mind. We do, however, see oversupply pretty often with exclusive pumping. This is not usually a huge deal though, just because you're dealing with expressed milk so often that you have some extra and you store it and you freeze it and you use it as you need. But it's not like moms who are combining the two where that oversupply can become a nuisance. And that actually leads us really well into our next category, which is those who are combination feeding at the breast and pumping. Now, this is where I live. This is my specialty, so I like this category. I'm going to try not to go on too many tangents here because many tangents are available. But your supply is dependent on both the baby and the pump, which makes it really, really tricky. You kind of have the best and worst of both worlds. We have the baby who is feeding on demand and managing the supply that way, but we're also adding a pump into the mix and altering the natural flow of things. Sometimes it's because you want to, right? You're trying to have that extra milk or whatever. Sometimes it's because you have to, like for working moms, which is who I work with inside my program. And, if you're using the pump to help meet your breastfeeding goals, for working moms, it gets tricky because sometimes you can see the numbers and sometimes you can't. Your milk supply is being managed by the baby on the nights and weekends and by the pump while you're at work. So you have to make sure that both areas are lined up appropriately. All of the stuff that comes with breastfeeding and then all of the stuff that comes with pumping. It's a lot. And if any part of that puzzle is out of whack, you could see some low supply, and we might not know why until we figure out which part of the jigsaw puzzle is not working right. We also see oversupply occasionally here too, because you are adding in that pump to the natural breastfeeding flow of things. Oh, that was a good pun. So if you're doing that too much or too often and it's not really helping you meet your goals, you can end up with an oversupply. And the tricky thing is here is you can think, yeah, I'll just like pump extra on the weekends, get that extra supply, and then in the week I'll just go back to my normal. But once you have an actual oversupply, you always have to deal with it. So you don't get to take a day off because your breast will become engorged and very uncomfortable, can lead to infections and things. So creating an oversupply on purpose, you can do that if it helps you meet your goals for whatever you're doing, but I wouldn't do it just for fun because it's actually not that fun. We're going to talk more about this combination a little bit later when we talk about low supply, because there's a really important point that comes in this scenario specifically when you're combining breastfeeding and pumping. I do want to touch on two other aspects of milk supply that we talk about a lot, and that is oversupply and low supply. So let's start with oversupply. This is defined as breast milk production that exceeds the volume required for growth of a healthy infant. This can happen naturally or it can be caused. So if you have hyperlactation syndrome, some women do have this, and I've seen even some women competing for the record of milk donated in the Guinness Book of World Records, which is cool. These women have hyperlactation syndrome. They are just making so much milk and their body did it naturally. So that can happen. It's not that common, but it happens for sure. A more common cause of oversupply is that you created it. So you asked for so much demand that your body gave you the supply, and it was actually more than your infant needs. This can be a good or a bad thing, like we've mentioned, and you'll have to decide for yourself or with the help of a lactation consultant if this is appropriate in helping you meet your goals. A couple reasons this happens just really quickly. Some moms want to do this. Maybe they want to stop pumping before a year, but they really want to give their baby breast milk for a year. Create an oversupply, stash away a ton of milk, and be done early. Good for you. I do see this happening a lot though for a not so great reason, which is that you're scared of low supply, so you go crazy overboard and create an oversupply, and then you have to deal with that. So if that's what helps give you the peace of mind and ease your anxiety about your milk supply, then maybe that is appropriate for you. But don't just do that because you're scared, because you're going to have to deal with this every day, and it's not necessarily a good thing. And then we have low supply. This can happen naturally. This can also be caused, and it can also be perceived. So natural low milk supply, if you have some risk factors for low milk supply, which are very numerous, and I will put them in a separate blog post down below for you, you can just have it happen naturally. And these include some underlying health conditions, previous breast surgery, things like that. This is important, not a family history though. Just because your sister or your mother had low milk supply doesn't mean that you're destined to also have that. So go ahead and check out those resources and see if you fall into any of those categories, but it can just happen. Probably the second most common area of low supply though is that it's caused, and this can be caused by breastfeeding struggles, either latch problems or tongue ties or breastfeeding mismanagement. Maybe we're not feeding appropriately and keeping up on things, or maybe the baby's not getting the milk out efficiently. So that can happen. If you're not feeding on demand, you're really watching that schedule. If you start supplementing, that can kind of be a downward spiral of low milk supply because you're supplementing instead of using the milk at the breast or stimulating the breast, and then it kind of just goes down and down with the more supplement that you give. Sometimes we have to supplement. It's not a bad thing, but that can contribute to low milk supply. Poor pumping practices can also leave milk behind in the breast. That will slow down your supply. If you're not removing all the milk that you can, your body's going to think you don't need it. So we have to be pumping efficiently, and we focus heavily on this in my program because especially when you're combining the two, combining feeding at the breast and pumping, we have to pull all the milk out that we can while you're away from your baby, because these women are often pumping just enough for their babies because your supply is managed by both a baby and a pump. So you have a lot less control than moms who are just using a pump. And you have to see the numbers, which you don't have to do if you're exclusively breastfeeding. So it's a really difficult in-between to be caught in. And then we have perceived low milk supply. This is honestly probably the most common, okay? Just the worry or belief that you have low milk supply when you really don't. I see this a lot in moms who are making just enough for their baby, which honestly is what biology designed you to do. Biology is not going, okay, we talked about that in Oversupply. Sometimes it does go crazy, but most of the time it's just going to make what you need. The milk supply worry is so real, and I see so many moms experiencing it. I see this often in my program too. When we actually make a chart together and you track your pumps and your output and how much your baby needs, and we sit down and we look at it together, we realize there's actually not a problem here. Yeah, you're not storing very much in the freezer, but do you need to? If you want to, let's tackle how to do that. But you're also feeding your baby and it's going great. So can we be okay with that? And having a professional tell you that things are going well and just trust the process can be really beneficial and help get you out of that scarcity mindset, really. Just assuming that you're going to have low supply or that it's not enough because there's no extra is not low milk supply, right? So keep that in mind. I always encourage moms to ask yourself, am I making enough for my baby? If you're breastfeeding, are they growing and thriving? If you're pumping, are you able to pump enough for your baby? Being a just enougher is not a bad thing. Perceived low milk supply can turn into actual low milk supply as well. It can also turn into oversupply. It's just a really tricky place to be. If you think you have low milk supply, so you start supplementing, you're going to be decreasing the demand in breast milk, which is going to naturally decrease the supply. And now you've entered this downward spiral of supplementation. So you didn't have low milk supply to start, although you thought you did. So you started supplementing and now it is actually turning into low milk supply. So just, be cautious. To leave you on a positive note, just about everybody can make enough milk for their babies. Biology is on your side. The best thing you can do is to really understand milk supply and the supply and demand cycle in and out, and then find the help that you need. I highly encourage you to find, if you're exclusively breastfeeding, a lactation consultant that you trust and that can help you navigate breastfeeding. If you're pumping, find a lactation consultant or someone who is very experienced in pumping to help you navigate that and get some validation when you're struggling. I specialize in helping mothers that are combining both. So if that's you, there's a link in the description on how we can work more together. But I hope you have a better understanding of milk supply and where to start in tackling it. There are more videos here on milk supply, managing it, and if you want extensive help and information, you can find me in my courses and program. I'll see you there. Good luck.